Hello, everyone, and welcome back to another episode. Today, I have a fellow dietitian on, and I heard her. Oh my gosh, I met a colleague of hers at a virtual conference, and through her virtual colleague, I got connected with Laura. And then when I heard Laura speak on her podcast, I was like, oh my gosh, she has to come on my podcast. I loved her no nonsense, like cut the shit approach, like get right to the point. Let's not like dance around it. Let's just get to it. So Laura is like I said, she's a dietitian and she's also known as the sassy dietitian. And she is very sassy in the work that she does. And she has 2 cookbooks and she is a former D1 athlete and she helps women optimize fertility hormones, gut health, and energy into a very, like I said, no BS approach. But today, Laura and I really delve into women's health and the complexities that women face with health and fertility. And we really dive into the dismissive things women get, like, oh, here's the pill. And Laura also shares her insights on the role of hormones, also what's impacting ovulation, and like, what's the sense of tracking? Like, why are we tracking? So we're really going to talk about the importance of listening to your intuition when it comes to what you're struggling with as a woman and really finding balance between the actual treatment that you have to maybe go through and self-care. So this is an amazing episode that I absolutely loved recording with Laura, and maybe something you can share with your fellow doctor. Let's dive in. Hi, Laura. Welcome to the podcast.
Thanks for having me.
Laura, I am so excited you are here. I heard you, gosh, where did I quote unquote meet you? I think it was was it through the nutrition conference? I was at this like Fuel Fest or something like that. And then there was one speaker. I started listening to her podcast and then I found you. And I'm like, oh my gosh, I need to talk to Laura. You just had such a no nonsense, like cut the bullshit kind of approach. I'm like, we have to talk some like controversial type of stuff here today. So welcome. And if you just want to share like a little bit of kind of background on who you are and what you do, and then we'll kind of talk about our topic today.
Sure. I love talking about all the BS out there, and there is a lot. So I'm a dietitian. I've been a dietitian for almost 14 years. I started in clinical, absolutely hated it, created my own private practice, dabbled in a bunch of contracting work, and worked with a lot of athletes, was a sports dietitian for a while, and then really settled into the women's health space because as you know, like as a woman, you're also facing your own uphill battle with working with practitioners. And a lot of my clients, for all intents and purposes, look healthy, yet they're told to just take the pill, or they're told that it's all in their head, it's just stress. And I was really, really frustrated with women's care. And so I really dove deep into women's health and helping women feel their best, through nutrition, through lifestyle, supplements, et cetera. And I'm also a mom of 2. And I think that's also helped me even hone in more of helping women in their fertility, pregnancy, and postpartum journeys and understand how to best support them as moms.
And thank you for sharing that. And yeah, because it doesn't stop when we decide to have babies, like after that. And I was just thinking recently, Laura, because Laura and I found out we have some commonalities. We have 2 boys and that are just a few years apart too. And we're both in upstate New York, which is really cool. And we were talking about the craziness of it. But I don't know about you, Laura, when I had my first baby, which was conceived via fertility treatment, and we're going to talk about fertility treatment today. I just thought like I just wanted a baby, and now I have like a 7 and 9-year-old, and like life is crazy. But even before that, I just want to say I just wanted a baby. My main goal was to have a baby, have a baby, have a baby. I didn't know what came after. This is my first time being a mom. I tell my son that a lot. I'm like, buddy, sometimes mommy makes mistakes. Like, this is only her first time being a mom.
I mean, that's so true for any life stage. Like, I feel like you only see support for like newborn moms, but like this is the first time you've had a 9-year-old, right? Like I feel like we're just so harsh on women and moms, and it's like this isn't your first time dealing with whatever stage you're in.
Yes, absolutely. And, I just thought like, all right, I didn't know all that came along with a baby of like the unpredictability, and now the unpredictability of like, is my 9-year-old going to be in a good mood or a bad mood? Like, there's a lot of unpredictability. And I think as a former type A person, which not gonna lie, I still got a little type A in me, but I don't know. There's just so much support that could happen after baby. But what I want to talk about today is like getting to the point of having a baby. And a big controversial, I don't know if it's controversial, but to me, you tell me your take on this, Laura. I feel like IVF or fertility treatment, we'll just say fertility treatment in general, whether it's IVF, IUI, whatever, is just not glorified, but like you have a problem with your fertility or your period or your whatever to get pregnant, it's automatically fertility treatment. Go, fertility treatment. Oh, you have fertility treatment. Is it just me, or do you feel the same way?
No, it literally boils my blood. And I just want to put a statement out there. I'm not anti-fertility treatments. I have plenty of friends and clients without fertility treatments. I wouldn't have their children to love on so deeply. So obviously not
Yes.
anti, but 100%. It's like even a little bump in the road, it's instead of looking at, there's so many things that we know about fertility now that we could look into. And I don't know about you, but when I'm working with women in this space, the men have never been checked and they're sent to IVF immediately. And I'm like, we know that 40 to 50% of infertility issues come from the male. And yet we put it all on the woman and she's sent to fertility treatments to have a baby. There's no talk on health. There's no talk on why. It's literally just like, oh, well, this is the next best step. And once again, there's a time and a place for that. It's just like, they just basically tell you it's a fast track and it's the way to get your baby as soon as possible, when really I view this, and maybe I'm getting ahead of myself here. I talk to a lot of women who come to me who are struggling with fertility, and I say, I'm not worried about just getting you a baby. I'm worried about you having a healthy pregnancy and a healthy postpartum so you can also enjoy motherhood.
Yes.
So that you also feel your best, whether we use fertility treatments or not, because I think the same applies no matter what. And yet no woman is ever being talked about like, there's only the 6-week follow-up appointment to basically check that you're not falling apart. Beyond that, it's like you're a used candy wrapper. The candy is here. The baby is the candy. And like everyone cares about that. And mom is just, who cares? She had the baby, move on.
Yeah. Yeah, pretty much in a nutshell. And I just think back to my journey. Now, I conceived my first son via IUI, and it took 3 rounds until I got there. And I'll explain why I think that is. But no shame in fertility treatment. I spent 5 years, Laura, trying to figure out why my period was missing. Countless doctors telling me to go on the pill or come back when you want to have a baby. But I'm like, but why? Like, can't you just tell me why my period's missing? Just please, somebody, anybody. And 5 years. And then finally, I was just like, I just waved the white flag. I'm like, I'm done. Like, I just totally surrendered and I gave up. I'm like, all right, I guess like this is just it. And so eventually my, I don't know, third OB was like, go see this reproductive endocrinologist an hour away. I'm like, okay, whatever. This is like my last. I'm done after this. And I finally got a diagnosis of hypothalamic amenorrhea. And then it was kind of like, no. Like I'm a dietitian, I don't have HA. I learned that HA is only for athletes, women, super low BMI, eating disorders. I'm like, I don't fit the box of any of that. So when I actually got the diagnosis, I didn't believe the diagnosis. And then once I finally started believing it, I started to eat more and rest more. And then I was like, I spent 5 freaking years trying to figure this out. I'm 30, which again, 30 is not old by any means. I think that's another timeline thing. Like, oh my God, I gotta have a baby by 30, or like your maternal age is advanced, whatever. So I decided to pursue fertility treatment because I didn't know. And I just spent so much time. And so that's why I also want to say there's no shame if you do decide to pursue fertility treatment. But, I like to say the but there, because my body was still in this state of like nervous system dysregulation and not probably giving my body enough time with the nutrition and with rest, and just completely fixated on the outcome of like, I have to have a baby. Like everybody's having babies around me. And it took me 3 rounds, and they weren't all back to back. So probably 6 months of on and off fertility treatment to finally conceive. And I think I conceived on that third round because I finally stopped really trying to control the outcome and like really focused on just living my life. And of course, nutritionally giving myself enough food and rest, but like not so much being so fixated on having the baby, but also living my life, if that makes sense. So,
percent.
yeah. And so that's, go ahead.
Well, I think what's so sad to me about that story, because your story, I feel like I've heard, not to like minimize it, but I feel like so many women experience this. And I hate the phrase come back when you want a baby, because 5 years ago, you were complaining of issues that were fertility related, but fertility doesn't necessarily mean wanting a baby. Fertility is just women being fertile, meaning they are healthy, right? Hormones are a luxury item. We can live with low hormones. Well, no. Do we feel our best? Absolutely not. But we can do so. We can be totally fine without a period. Fine being very relative, like, right? Like, obviously it
Yes.
puts us at risk for other things and we don't feel our best, but like, it's a luxury item. And so to tell a woman to just come back when she wants a baby, first off, if she comes back in 5 years and wants a baby, and now you're telling her, oh, well, we gotta do all this other things to get you there. Why couldn't you have done them 5 years ago? And I think, unfortunately, there's a lack of education in conventional medicine and outside of dietetics of understanding the necessity of nutrition and lifestyle interventions that help with fertility, whether the woman wants a baby or not. I mean, I tell every woman who walks through my practice, I don't really care if you want a baby. I mean, I do care if you want a baby or not, because obviously it's going to tell me like what our plan is. I'm going to treat you the same no matter what, because you want to be fertile. And then we talk about working with your provider and your partner to help prevent pregnancy if that's actually what you want, because I'm going to make you more fertile. We need to make sure that you protect if that's not something you want. But it's just such a disservice to women. And oh God, I could go on so many tangents of like just offering birth control. Like, it can't tell you how many women are offered that. And it's like, you were screaming for help and it's no fault of your own. I think every practitioner, my one friend says it great, like, we're the pill inside the pill bottle. We cannot read the label outside of the pill. Every good dietitian needs a dietitian. Every good doctor needs a doctor. Every good athlete needs a coach, right? Like, we all need that support. And it's just a shame that women are getting the same advice. They're literally getting come back when you're pregnant and take the pill. Like, that's literally like textbook of what women are being told. And then they come when they're looking to have a baby and they're wondering why they can't have a baby. And it just breaks my heart, because I'm like, God, like, there's so many reasons. And once again, there are some unexplained infertility cases that I truly believe like are unexplained, but they are few and far between. They are not the large majority.
Yeah. Yeah. I think about that all the time, Laura. I'm like, this quote unquote unexplained infertility.
So much of it's explained.
So much. Like, I wonder if they could ever do a study, which probably would never happen because whatever. It's like, but the percentage of unexplained fertility that was actually explained fertility is probably like 98%.
I agree. Like, I truly, I mean, there's a reason that IVF and IUI came to be, right? Like, I do believe that there's a small subset of couples and individuals who we don't know. Like, I have a client right now who we're doing all the things and I'm like, you check all the boxes for all the things that I would have checked for. But all my other clients, oh my God, like, I look at their intake and I'm like, you're eating 1,200 calories. Like, did anyone talk to you about this? And they're like, no. I'm like, your thyroid your TSH is 4. Has anyone talked to you about that? No. Have we run a semen analysis? No. I'm like, okay, then how can we call this unexplained? It's basically just
we didn't. Yeah.
Right. Like laziness. Like, they didn't want to look any deeper. And they have a tool that they're like, oh, we'll just use IVF. As if IVF is, and obviously IUI as well, but like IVF, the amount of hormones that women have to put themselves on and inject themselves with, it's not nothing. Like, not just financially, right? We know financially it's a big burden on people, but the toll it takes on women's bodies, like, it's almost as if it doesn't matter. They're like, oh, well, you're going to get a baby. But like, what about the women and all they put their body through?
Yeah.
Like, that's also not necessarily fair to the woman to just be like, oh, it's just IVF. Like, just go that way, as opposed to like, let's dig into as much as possible. I mean, I know patients who haven't even been checked for like clotting disorders or predisposition to clotting issues. And I'm like, I'm not a doctor. I can't order those labs, but like, you need to ask for those labs. Even I know what to ask for. And I'm like, a lot of people are not doing their due diligence. And I don't know if it's just lack of education, lack of time, because I also try to look from a provider status. Like if they're seeing 20 patients a day, I also know how exhausting that can be. But I also find it hard to, like, I don't know that I'd be able to sleep at night if I constantly just told people, like, just go to reproductive.
No. I
Whatever.
definitely wouldn't be able to sleep at night. And like, what is it really? Because I don't want to sit here and be like, these damn doctors, like, what the hell are they doing? Like, this is lazy medicine, because that's not the case. There's many factors involved. But at the end of the day, are you doing the right thing as a provider? Are you doing the right thing by just like, throwing shit under the rug and not really? I mean, I had clients of mine, Laura, tell me that their doctors not only said that IVF wouldn't work for HA, but the doctors didn't know they had HA. They were just kind of like, oh, I don't know why your period's missing. Like they need a surrogacy because their AMH is in the shitter and like you need to get a surrogate. I'm like, could you imagine, like as a mom now, Laura, if you were told you could never bear your own children?
And I think that the way the way it's presented to these women as if it's no big deal. Like, first off, surrogacy is incredibly expensive. And second off, like, you're right. Like, you're basically just telling the woman you don't matter.
Yeah.
Don't care. They're not saying it outright, but like, we don't care why you can't have a baby. As opposed to like, why not leave everything unturned for that woman?
Yeah.
And then if that's still the case, obviously we can explore other options, because obviously there are other ways, adoption and surrogacy being other ways to have children. But like, I just feel women become so dismissed, and then like they're taught that they don't matter. So then this spirals into motherhood, right? Like they don't matter. It doesn't matter that they feel like crap. Like, but you had your baby. You're so happy, right? I work with so many postpartum women who feel awful. And then we also run into secondary infertility issues as well. And I don't think it's necessarily secondary infertility. I think it's that the mom is so depleted and dysregulated that her body is protecting her. And nobody ever helped her because all they said was take a prenatal while you're still nursing, and best of luck. There was no support for the woman to actually recover and understand how to treat her body postpartum. So I know that was like 3 different tangents, but like, it's just so sad to me that it's literally just about the baby. It has nothing to do with the mom.
Yeah. No, it is. It is. It breaks my heart. And, I was one of those women. And yeah, I could say that I felt extremely dismissed. And another thing I want to say is that I don't know where along the road of this all is that the first point of contact was me going to a doctor, which is most of us, right? But I trusted these medical professionals over my own body. And I knew, and deep down inside, I'm like, I think I'm going to have trouble getting pregnant. I just knew. And then for, like I said, 5 years, this doctor to that doctor to this doctor. It's like from, I don't know if it was a young age. I don't know if it was like upbringing, because like to this day, I think my mom will say like, oh, well, the doctor said, I'm like, it really, like, you can take that with a grain of salt, So I don't know that like the body, not to trust the body, and that medicine is like the authority. And if something is broken, I need a doctor, not like,
I mean, I
why
think
might
that's
this be
just a
happening?
narrative for women in general. Women are taught to not trust themselves, that they're not good enough, that they need to be smaller, that they need to be quieter, that they need to be whatever, fill in the blank, right? I mean, we're seeing skinny talk take off again too. Like, it's mind blowing to me, like the narrative that society creates for women. And so it's no wonder that women don't trust themselves, because how many women grew up with almond moms? How many women grew up, looking at magazines of supermodels? And so they just basically assume that like, okay, one, I have to look this skinny, right? And then I also feel like crap, but like everyone says I'm fine, so I guess I'm fine. Like I don't want to like raise any alarm bells when I'm fine. And it's so sad that women, and then think about how many women do speak up and told they're crazy, right? Like women were called hysterical during their luteal phase. Like it's insane. So then it's hard. So then women try to speak up. They're told they're crazy, that there's nothing wrong with them. So they suppress it and they say, okay, you're right, I'm crazy. Like the doctor said, I'm fine. And it's just this vicious cycle, and it drives me crazy. Like so many of my women who come to me, they're like, wow, you're the first person who's actually validated how I felt. And I'm like, I'm honored to be that for you, but that's not how this should be.
Yeah.
Like,
No.
You should be listened to. So what? Like, I've literally never been in anyone else's body. I don't know how other people feel. And so you are the only person who will ever know how you feel. And so what if your intuition isn't exactly spot on? Bring it up. Bring it up of like,
Yeah.
I ask all my women when they start working with me, what do you think is wrong? Intuitively, what do you think is wrong? And
Yeah.
sometimes they'll go, honestly, I have no idea. I've been so disconnected from my body. I have no idea. And sometimes they'll be like, I know it's a digestive issue. And I'm like, great, let's start there. Like, who am I to say? Obviously, I'm an expert and I look at the labs and I take all your symptoms and we work together, but like, you are the only person who will ever be in your body.
Yes, yes, absolutely. And I think we do. We put so much into others' opinions, especially, medical professionals. And like you said, Laura, like either you're going to feel crazy when you go to the doctor, or you might be validated. And I don't want to go off too much in a tangent, but validated the fact that you're healthy, you're fine, your weight is fine, keep exercising, eating healthy, like you're fine. And then that validates that disorderly voice in our head.
That's so true. Yeah. I mean, I tell all my women, I think every woman that works with me, I'm like, you, for all intents and purposes, you look healthy compared to the average American. You're going to walk into a doctor's office and they're going to take one look at you and dismiss you or validate you because you look a certain way. Looks do not mean anything truly, because if you're having anxiety, you're not sleeping at night, you're having fertility struggles, whatever it might be, like that's an issue and it matters. And so we talk a lot about advocacy in my practice of advocating for yourself and not letting that be the discussion of like, oh, you look healthy, come back later. We tell my clients, I'm like, if they refuse to check something, make them document in a chart. Say, hey, can you document that you're refusing to do this for me? Straightens up a lot of providers.
Yeah, I like that one, Laura. I like that one a lot. Yes. And we have to be advocates for ourselves. Like, yes, we do need doctors and mainstream medical, but bottom line is we have to advocate for ourselves and speak up, which could be really hard. And I decided to do an experiment one day. And this was, I don't know, a few years ago. So way past like my disordered days with eating and fertility issues and so forth. And, I don't mind going to the doctor to be weighed. It doesn't bother me. But at the same time, I'm like, I know it used to bother me, and it bothers all of the women I work with. I'm like, let me just ask them not to weigh me, like just see what happens. And I was kind of feeling like a little bit anxious over it. I'm like, well, whoa, what's going on here? Like, you're just doing it as an experiment. And I'm like, wow, like there's some connection there with like feeling like they might be like the authority or something. I don't know what it was. So I asked and they said, yeah, of course not. And I'm like, okay, cool. But I've had many clients say that, oh, we need your weight. And I'm like, no, 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 no. We don't
For what?
need your weight.
That's what I would
Yeah.
ask, right? Like,
Yeah.
there's obviously certain conditions that, like kidney disease and heart disease, right? Like, obviously, those clinical needs to know, but also you don't need to know. Like, you can always, if they really need to know and there's a valid reason for it, like sometimes medications, although we're not doing a good job of prescribing for weight anyway, but if they need your weight for medication, you can ask to turn around and ask them to not put it in your physical chart or in your like electronic chart. And it is hard. And this is something I always bring up to my clients because so many of my clients have issues separating health and weight. And they'll come to me and they'll be like, oh my God, my bloating is gone. My gas is gone. I'm sleeping through the night. I have so much energy, but I'm still 10 pounds overweight. And I'm like, are you the healthiest you've ever been? Yes. Do you feel the best you've ever been? Yes. And I say, okay, do you think those 10 pounds are something your body just really needs to be healthy? And they're like, I've never thought of it that way. I'm like, right, because you equate health to weight. And when you walk into the doctor's office, what's the
Yeah.
first thing they do? They weigh
Way
you.
ya.
And so you were trained that my doctor needs to know my weight. And you're absolutely right. Like 9 times out of 10, they don't need your weight. It's probably going to actually sway them in a direction that's not helpful, right? Because one, you
Yeah.
might be a normal body size. So you bring up a problem and they say, well, you're a normal body size, right? Like your weight's normal, your BMI is normal, or it could be the flip side of like your BMI is 27 and they're telling you need to go on a GLP-1, that's your problem. And it's like, I came here because I'm having reproductive issues, not a GLP-1 issue. So I think it's really hard and it's hard to separate weight from health. And it's not to say that weight cannot signify health issues, right? It's not an either or, it's not mutually exclusive. It's understanding that health is so much more than weight and weight is truly just one metric of health.
Yes, absolutely. And if we focus on our health, our weight is going to do exactly what it needs to do. So, and it may not be the number like you're happy about. But again, you're going to let an arbitrary number dictate, right?
Just your relationship to gravity. That's all it is.
Yeah. So anyway, so I wanted to circle back to kind of the IVF thing and, if women took, I don't want to say if women took the time out, there's many factors, but I think IVF, I know for me doing IUI was like, felt like I was doing something,
Yeah.
especially when I wasn't getting the results of waiting on nourishing my body and resting it and like regulating my nervous system. It almost felt like I was, I don't know, not being irresponsible, but kind of lazy, especially if I wanted a baby like yesterday. So I'm curious, Laura, like how would you, I guess, how would you approach that of being like, okay, I know like you want a baby like yesterday, but also, you know, I guess what advice would you give to that woman of,
Well, what I have run into is the hardest part is that the reproductive centers, the fertility treatment centers are far better at selling than I am. So
yes, oh my gosh,
it
yes.
feels like an
I'm
uphill
so glad you brought
battle.
that up.
Like it feels really hard. And so I always tell people I'm willing to work with you through your treatment because I also think that like you shouldn't just be working on just artificial reproductive technology. You should also be working on diet, lifestyle, and gut health or whatever else we're working on. But yeah, that I have to say, start with that. It's so hard. And I'm not trying to compete with them, but it's really frustrating when I'm telling the client, like, give me 6 months for us to improve diet, lifestyle, for us to work on gut health and hormone health and improve your sleep and all the things your body needs foundationally. And then we can go there. But then they go to their, fertility appointment, which of course they've probably been waiting for 3 months or more. And they're told, oh yeah, we'll start a cycle immediately. We'll start egg retrieval like next month. We'll put you on birth control for a couple weeks, get you on this, and then we can do a transfer as soon as 2 months from now. So that's really frustrating. And I'm not mad at my clients or potential clients for that. I'm not trying to make you feel shame or guilt. I'm just more mad at these fertility clinics for more or less not stopping to say, okay, are you getting a regular period? Have you looked at ovulation? What labs have we done? Have we looked at a semen analysis? Have we done a genetic testing? Like, I don't know. There's like 10 factors that I usually look at. I'm like, they haven't even looked at this. Like, women with PCOS, no one's looking at their fasting insulin. Women of normal body size, they're not getting their thyroid panel looked at. Like, there's so many things that like we look at, and I usually find at least one thing, usually many. And that's really where I tell women, like, the biggest thing I can tell women is I don't want to just get you a baby. I want, of course, you to have a beautiful baby, but I want you to feel your best because you deserve to feel good when you're pregnant, as good as you possibly can. Obviously, pregnancy is variable for many people, but then
Yes.
also good in the postpartum because we're working on building up your foundation so that you get to feel your best now, then, and in the future. And I know that's hard because it feels like the timeline feels like your clock is ticking, but for most people, it's not. Like for most people, yes, there are people who certainly we know that their reserves are really low and we know that time is ticking, but like under 35, like your clock's not really ticking as fast as you think. And if you gave yourself 6 months to work on that foundations, even if you still need reproductive technology, you're going to feel so much better. I have had clients come to me who literally just feel awful 3 months in, they're like, I can't believe I didn't even realize how awful I felt. I'm like, yeah, because you're running on empty. You're not eating enough. You have gut issues. We're finding some heavy metal issues. Like there's so many different things going on. Of course you felt awful. And nobody stopped to think that like, maybe she needs actually more support than just a IVF cycle.
Yeah. Oh my gosh. Yes. And it truly breaks my heart because not only, just starting from the very first point of like the not competition, but like IVF, or fertility meds, like the selling point, like those fertility clinics are in the business of getting a baby and not looking at the underlying root causes. And it's so important that we look at that for so many reasons. But like you said, Laura, it's like, yeah, not only do I want you to have a baby and have a good pregnancy, but what's life going to look like after? Because now not only do you got to take care of yourself, you got this other little human. to take care of.
Yes. Yeah. And I feel like
So
that's so dismissive. I mean, because think about it. Most women are released from their fertility clinic between 8 and 12 weeks. So they're not even staying there for the duration of their pregnancy, which is fine, right? Like they're going to their preferred OB or midwife or whoever. But like they're just like, okay, great, you're pregnant, you stayed pregnant, carry on. Doesn't matter that she literally was so depleted and she just happened to conceive, thank God, to technology. But, it
yeah.
just makes me sad. And once again, I think that there's a time and a place for IVF, but it's like we're not even giving women the chance because we're not supporting their actual, like you said, root causes of why they're here in the first place, let alone the male root causes, which drives me up a wall because
Mm.
if you look at the other problem is the men who are having sperm analyses done are told that they're fine, but we decrease standards. I think this is so messed up. Like you can tell that the male ego is so fragile because instead of taking the numbers and saying, nope, you're the problem, we've been like, the population is like their sperm is decreasing, their motility is worsening. Let's just lower the standards. Like, are we kidding? Like, so I mean, obviously I know we're talking mostly to women, but I also think it's important. It's a shared responsibility. And the second a man is not on board, I'm like, I don't know, maybe it's the universe throwing you a bone because if that partner is not willing to be a part of this process, they're not going to be a great partner either. And like, obviously I say these way more gentle to clients, but
Yes,
I would say
of course.
99.9% of my clients, the men are like, yep, just tell me what to do. So
Yes.
but
Yes.
that's a whole nother topic of like most men are given a gold star and I say, no, send me this sperm analysis. And I look at it and I'm like, first off, we don't test DNA fragmentation because insurance doesn't cover it and it's really expensive. And most men, if they have normal sperm analysis, a lot of them struggle with DNA fragmentation, which can cause lack of implantation and conception. There's that whole rabbit hole too. And God forbid we put any of the responsibility on the men.
Yeah. And yes, that is a whole deeper conversation, right?
Yes.
And I think it's anyone who's listening is just important, to know that once you got your stuff underway, like if you don't have a period, you're not ovulating, you're definitely, you're not going to get pregnant. But also once you start to recover and, get your periods and ovulation back on track, like that's something also to look into among other things, right? The male factor. So, which is very under talked about, but, fertility clinics are in the business of fertility and, unfortunately not treating the underlying root cause. And maybe one day that'll change, but I don't think it's going to be happening anytime soon.
There's no money in health. That's the problem, right? There's no money within healthy people. And that's a whole nother topic for a whole
I
other day.
know,
But
I
like that, I
know.
think that's the issue is they don't make money off of you being healthy, which is, I guess, when it comes to pregnancy and like delivery and labor is not totally true because there's a
True.
lot of
Yeah.
money in like delivering a baby. But I think that's the issue, right? Like in a capitalistic society, we're not making money off of a healthy individual. And that is awful to think about. And so I think it's important to I think this is where a lot of women's health drives me crazy is that we don't have a lot of informed consent and like true informed consent of like, here's what IVF is not just going to cost you, but here's what's going to do to your body. And here's what we should do prior to prepare your body, whether you need it or not. And we never talk about that because who cares, right? You're just a candy wrapper who's going to be used to form a candy. And then we don't care about you.
Give me the baby.
Give us the money and we'll give you the baby and carry on with your life.
Yeah. Yeah, unfortunately, yes. And I just want to say when you were talking earlier about like the timeline of like, yeah, if you work on the underlying root cause, it may not be as quick as maybe getting pregnant via IVF or IUI or something. But that's not necessarily true because I felt like I was doing more and doing better doing the underlying root cause way. But then I decided to go to fertility treatment because I was getting impatient. But then that also took some time. So we also want to say that fertility treatment is not the quick fix a lot of times either. And just because it's, you hear you'll get a baby through IVF, it doesn't always mean that it's going to happen if your body isn't in that place of, I guess, readiness to carry another human being. But I think if I could give myself advice for when I was younger, it would be to, hindsight is 2020, right? Of course. But for anyone listening that is kind of dabbling between the two, I wish if I had the tools I had today, I think I would say, give it more time, regulate your nervous system more, eat enough, rest enough, live your life, and it's all going to happen. But, every month for me when I was wanting to get pregnant was like another month lost. Like, oh my gosh, like I didn't get pregnant this month. I didn't, and now it's going to be, if I get pregnant next month, then I'm going to have a baby on Christmas, or like you have these like timeline things in your
Yes.
head going on. And I would just say, please just let go of the timeline. It's going to happen when it will happen, as long as you take care of your body. And by the way, if you do end up pursuing fertility treatment, your ovaries are probably going to be hyperstimulated. They were actually the second round of fertility treatment. I was hyperstimulated. I was out
No.
of work, I think, for like 2 weeks or something.
I've heard that's awful. I'm so sorry.
Yeah. So, and okay, you were scared of gaining weight, Cynthia. Well, you're probably going to gain even more weight with fertility treatment because of all the hormones and all the stuff. And like, yeah, all the appointments, all the things. And again, not pushing you away from it, but just saying, like, can there be a balance with you taking care of your body and maybe pursuing it alongside, or giving yourself the time and the space to let your body heal and rest and, do what it needs to do so you can support healthy ovulation and therefore be able to support a healthy, beautiful little baby.
So true. I
So,
think a lot of women struggle with this. I struggled with this trying to conceive my second. I thought they were going to be closer together, and it took almost 6 months. And I remember I went to therapy, which I cannot stress enough. If you're not in therapy going through fertility struggles, like, you need to be
oh my gosh,
yesterday.
yes.
But I had a therapist tell me, and she was like, "Are you living your life, or are you living your life like day to day hoping for a baby?" Like, she phrased it much more eloquently than that. But the way she was talking about, I think we may have talked about this before we got on air, but like, I wasn't living my life. I was literally tracking every cycle. I was, hyper fixated on, like you talked about, like the timeline, when my kids were going to be, how far apart they were going to be. I was trying to control a lot of different things. And I realized I wasn't living my life, because she told me, she's like, "What if this baby never happens?" And I was like, "Well, it has to." And she's like, "But what, like, just humor me. Like, what if it doesn't? Like, are you going to sit back and wish that you had spent all that time worrying about it?" And obviously that's easier said than done, but I think
Of
it was a
course.
really valid point of, like, once again, we don't prioritize the woman and the mom, right? We just, it's so focused on the baby. And honestly, I hate when the people are like, "Stress less," and like, "It'll happen, go on vacation." Like, I'm not trying to say
Oh
that
my
at
God.
all. Don't mince my words. I think
Yeah.
that is awful advice. But literally,
Totally.
I stopped tracking ovulation. I stopped doing all the things, and we got pregnant next cycle. And once again, I don't want to belittle people who are going through that, but I do think it's important for women to prioritize themselves, not just the baby. And I know that's so hard to separate, but like, what are your favorite hobbies? What do you do to bring you
Mhm.
joy? Who's in your life that you get to lean on and have not just those hard conversations and venting conversations, but like, who do you share your joys with? The fun moments, the good times, right?
Yeah.
Like, I just think, especially in today's day and age, like, we become so isolated. And I think women, they really, like, when they're in these fertility cycles, they become this like hermit, right? Because they're so focused on timeline and dates and meds and
Shots and
appointments and
yeah.
shots, right? Like, and I'm like, I just had a talk with a client last week about it. And I'm like, "Who are your friends?" And you're just like, "Oh, so and so." And I'm like, "When's the last time you talked to them?" "I don't know." And I'm like, right. You get to still be you, as hard as it is. Women are so good at just like grit and bearing it. But you deserve community. You deserve to have people who are in your corner, who are the first people to know that you're going through IVF, who are there, good, bad, ugly, whatever. And you get to be you. Go do a hobby. What lights you up? Is it going to the gym within reason, right? Is it joining a bowling league? Like, I don't, there's so many things to
Yeah.
do. Be you. And I think that's where I hit the road with motherhood. I was like, I'm not just their mom, right? I'm still Laura. I'm still sassy. Like, that's still
Yeah.
who I am. I just look different, right? Because I have a child, right? Like, my life is not, I still live and die by nap schedules and all of that. But like, I think a lot of women forget that, because if you think about it, like, nobody in the IVF center is telling them like, "Oh, what'd you do for fun this weekend?"
Yeah.
They're like, "Hey,
When's the
when
last
did you
time you
ovulate?"
played? Yeah,
Yeah.
yeah. When did you ovulate? When was your last menstrual period? Yeah, yeah. And I think too, similarly, Laura, even though with my first I pursued, fertility treatment, it wasn't until I started focusing on me and who I was, bringing joy and fun and all that into my life. Therapy, of course, was a big thing, other spiritual practices. Yeah, that was definitely instrumental, not just enough fuel and enough rest. That was hugely instrumental. And plus, the beauty about that is that then when you do become a mom, you're still you, you're still Laura, you're still Cynthia, because that is quite easy to do as a mom, to lose yourself and to
Yes.
just do the daily tasks and not have any room for anything else. Almost like you become a shell of yourself and you are living your life, but you're like also watching it pass you by at the same
Right.
time. So yeah, that absolutely huge. And I can't remember where that started and how that
I
went,
don't
Laura,
know. I'm
but
sorry, I go on tangents.
oh, no, that was beautiful. That because I think that's just so important to hear. And, a lot of my clients will describe themselves as robots or like super disciplined and that was me at one point too. And so I totally get it. And it's like life is so much more. Life is so much more than just checking your to-do list, getting your workout in, and especially if you want to become a mom one day, and even if you don't do you want to be connected to the amazing people in your life? And if you don't have amazing people in your life, let's find you some amazing people in
Yes.
your life.
They do exist.
They absolutely do. And to have more fun and play. And it was the tracking thing that I wanted to talk about
Yes.
briefly is that they're in this missing period, ovulation, fertility world, is that we focus a lot of our attention on the tools.
Yes.
And sometimes those tools they're like half-assed. They don't even work or serve what you're doing. And we'll talk about that in a moment. But it's like you're putting all this emphasis on the tracking, but is the tracking what's going to bring you a period or a baby? Right? No.
Especially because, and I'm sure you see this too, but so many women who are tracking, they know when they're ovulating. Like, that's not a surprise. Obviously, if they don't have a period, that's a different story. But so many women who are ovulating and having regular menstrual cycles, I'm like, you know when you're ovulating. Like, you've done this how many times? Like, it's not a matter of knowing, it's a matter of you feel like you're controlling it. And that is honestly where a lot of them, I think, it just creates this stress cycle of like,
Yeah.
okay, today is the day that we must do it because it says on this app. And it's like, first off, that's not fun. And second off, like, your body doesn't need that stressor of telling you when you already know. It's obviously a different story when you're not having a period. Obviously, you don't know when you're ovulating, or even someone with PCOS. I understand that's a little bit harder too. But even so, like, you're right. Like, what does your body need? Like, did you eat breakfast today? Have you been hydrating? How much did you work out this week? Like, that stuff matters so much more than what the tracker is telling you. Not to mention, they get really expensive, some of them.
Yeah. Yeah. The tracker, I like to say, is not going to move the needle. What is like, okay, the outcome is, we'll just say a period. Okay, is tracking going to get that period, or is getting enough nourishing foods, getting enough rest, nervous system regulating going to get you that period? Yes. But it's like, I
Yes.
want to know. I want to know. Okay. Well, you want to know. All right. Well, let's track. Okay. Now, when you track, how does it make your body feel? Oh my gosh, like I feel anxious. I feel worried. I feel like, okay, now we have our answer. Maybe
Yes.
tracking isn't right at this particular moment, or maybe ever. But, just listening to that, because I think it's that tangibility or that arbitrary number, a sense of control, right?
Percent.
Sort of say. So I know there was a podcast episode I was listening of yours, Laura, and it talked a little bit about tracking. And I think a big one now is tracking progesterone levels. I think, is it with Prove? I can't remember what it's
There's
called.
the three big ones that I know are Prove, Anito, and Mira. And they're all
Yes.
different mechanisms. I mean, they're all similar, but like different machines.
Could you explain the difference between like actual like metabolites? Like, cause I don't know if all of them, but I think it's Mira or potentially all of them track the metabolites in the urine versus like the actual progesterone levels. Could you explain how it's maybe not always the most
Well,
accurate?
first off, hydration status is like step one. Like, it could totally skew it just based on hydration status. Time of day can change it, especially progesterone, because progesterone could be changed time of day, a serum value, a blood value as well. And so you're supposed to test same time every morning to decrease some of that variability. But there's so many different things that can impact the metabolite of it in your urine. And so almost always, if someone, I I probably said this on the podcast, that usually the only time I'm using tracking is in my perimenopause clients. And usually it's because we're trying to get a gauge of when symptoms are occurring, what are we seeing, so that we can bring it to the doctor to get further evaluation. It's not, to me, it's not like a diagnostic tool. It's kind of like a screening tool. And I find it best in perimenopause, usually because there's none of that pressure. They're not finding pressure to ovulate or have a period or have a baby. We're really just using it as data so we can go and ask for HRT if that makes the most sense. And it's just like a low, not to say it's low stress time, but it's a low stress option for perimenopause because there's no outcomes that we're not looking for a perfect progesterone. We're actually usually looking for progesterone to dip so that we can go get progesterone. Replacement. So, but that's the issue too, is that I think a lot of women, when they're tracking things like estrogen, progesterone, they freak out because they're like, oh my God, my progesterone dropped. And it's like, yeah, but it's like an order of magnitude that's not that big. And it's a urine metabolite. So it's not even equated to what's in your serum. So we need to go test your blood in order to confirm that. And even then, we can usually tell when someone has low progesterone based off symptoms alone. So I'm not saying it's not worthwhile. I just think, like you said, it's a control mechanism, especially for those trying to regain a period or to have a baby. I just think your stress is usually one of the roots, not always the root, but it's one of the roots. And so it's just creating more stress. And yes, I'm with you. All my clients who have ever done it, I mean, they usually come to me doing it and I'm like, no, like, we're not doing that. They say, yeah, I'm like panicking every morning, like waiting for the results. And I'm like, that's doing us no good. It's not helping us. And we can usually tell if someone doesn't have a robust progesterone based on their luteal phase. So like, I can just tell right away if you're going to need progesterone support without having to track anything.
Yeah, absolutely. And I love how you explain that. And I'm just thinking perimenopause is probably not too far away from me. And maybe I'll be contacting you, Laura, because that's something that I am not, I focused on missing periods and, HA for so long. So I know a lot about that, but definitely not in the perimenopause. But our careers are always
The
evolving.
good news is there's so many pioneers right now who are speaking out on it, doing research on it, and providing support on it. It's such a cool time to be a part of all of this because information was not available 5, 10, 15 years ago, which I feel so sad for women who just, once again, think about women who are in menopause currently. They spent their entire life being told to like, be quiet, you're fine, suck it up, it's no big deal, we don't want to talk to you. Like,
Just a part
you're
of
in a
life.
period? Ew. Right. And so it's nice that we're finally having women in the science world speak up about it, speak out on it, and do research on it because there is so much more information on it too, which is cool.
Yes. We are evolving slowly but surely,
We are.
right? Yes.
I think with a lot of women's research, we're so far behind, and it can take, 10 to 14 years for the research to actually come into practice as well. And that's a lot of times what I tell my clients of like, I'm not saying like I'm an evidence-based practitioner, but being an evidence-based practitioner is not only relying on the science, it's also relying on my clinician like experience as well as my patient's experience. And that is what evidence-based practice is. So I'm not waiting on the research to do what I know is going to be helpful for you. I'm going to use the research and clinical practice as a guide and then use how you're responding as the final, puzzle.
Yes, that is just, I wish you could say that 10 times over because I think that's where a lot of us get caught up too. And our doctors, I would say most of our doctors are looking at research that is like, we're 14 years behind, like it is not. And then your doctor also is not seeing like specific, so dialed in like criteria, they're seeing, polyps, they're seeing, perimenopause, they're seeing like all of it. And here you are, I am very specific areas of focus. And then also taking our evidence-based practice of what's happening with our clients and patients now, versus just relying on the research that again, it's going to probably come to these peer-reviewed articles 14 years later,
Yeah.
So that's really
I
important.
mean, it's actually interesting. I dove down the like progesterone rabbit hole with my second because I had done a Dutch test, which is urine metabolites, because I will do anything because I'm like, well, I'm going to run it with my clients. I want to know it myself.
Yeah.
And I
course.
ran it and my progesterone was really low. And so immediately I called my midwife. And of course, I found out like 2 days later I was pregnant. And I was like, we need to run a serum lab because I'm concerned. And my serum lab was pretty low in progesterone as well. So it was pretty correlative. But I tried to do research on progesterone in preventing miscarriage because I had had a miscarriage prior to my first. It's, obviously, there's many reasons for progesterone, but also I'm like mid 30s at this point. And I had asked her, and she's like, there's only research on artificial reproductive technologies, which is IUI, IVF, et cetera. And so there's not really research on progesterone implementation on women and reducing miscarriage. But if you go on Reddit, you go on forums, the amount of women, which I don't recommend people go down Reddit and forum rabbit holes, but
Rabbit
the
hole alert.
scientist in me was
Yeah.
like, I'm so interested. And the amount of women who said I was having miscarriages until I was given progesterone is absolutely insane. And then there's going to be research on that someday, like mark my words, of like there's obviously probably the main reason for miscarriage is chromosomal abnormalities, which is the body's way of protecting you and baby. Like we're not trying to, create a baby who cannot live. But I also think that progesterone, especially because women are having babies later, is an issue. If women weren't having a cycle and now are having a cycle, it's possible that progesterone is too low. So I also think like, it's so interesting to me of like, okay, so insurance doesn't allow progesterone supplementation to be covered until you're going IVF, IUI, but it's such a low risk, low like bar intervention. How are we not even doing that? Even that alone is a whole like another argument that I get into. And like every woman who comes to my practice who finds out she's pregnant, we get a progesterone serum test, a blood test immediately to know if we're going to push for progesterone supplementation or not based on levels. So like, there's just so much we can do before someone gets there that it's just mind blowing to me of like, once again, not anti it. I think it's great, but just like poor women, like they're literally not giving these low risk tests and interventions prior to giving the higher risk, higher dose, more intensive, more painful interventions. I mean, I think there was a study that just came out about HSGs, which basically are putting saline into the fallopian tubes to see if there's any blockages causing fertility issues. And women have not been given pain medication for it historically because they're told it's not a painful procedure. There's finally research showing that it's painful for the majority of women receiving this. Why did we need research when women are screaming saying it's really painful? It's just like it's IUD insertions as well. Like we just don't believe women. We're like, it's fine. Just pump the fallopian tubes full of saline. They're fine. Anyway, sorry, I go on 20 different tangents, but this whole subject
there's so
I'm
much.
so passionate about it. Yeah.
I know there's so much, Laura. And luckily there are practitioners out there like you, myself, and others. And it's like now if I ever have like something I'm dealing with, whether it's like, kid stuff or because one of my kids actually, and I'll share more with you off the cuff, but has a diagnosis of PANS. And guess where I found that out? It wasn't my pediatrician.
No chance. Yeah.
So anyways, but that's another topic we could go into. But anyway, there's a lot out there, but I guess to wrap it all up, if we can give, women one bit of advice after our conversation, what would you say? I mean, we gave a ton of advice, or not advice, but like, things to think about. But what would you say, like a big takeaway after listening to this?
I think it's something you've been touched on is like, listen to your intuition. If you feel like something isn't right, it's probably not right. And there are providers out there who are willing to work with you and listen to you and believe you and support you and run further testing and dig into your history. I promise you, like my intake form is insanely long and gets longer by the day because I want to make sure there's no stone unturned. And I'm just a dietitian. Like there are providers out there who know far more than I do and are far more well-versed in this. And if you feel called to do IVF, if that feels right to you, do it. But if it feels like, God, I guess I have no other option, this is it, ask questions. Ask for, what other tests can be run? What are we doing to support me and partner? Ask questions, lean into that intuition, and look for a provider who's actually going to listen to you, not just dismiss you and tell you, this is just how it is. Because I promise you, there are so many providers out there who will listen and who will support you. I know a handful myself, and I'm happy to share if anyone reaches out.
Absolutely. Thank you so much, Laura. And if anyone wants to find Laura, where can they find you?
Usually you can find me on Instagram at The Sassy Dietitian. I'm also on TikTok. I have a website, thesassydietitian.com, 2 T's, no C. But I say usually because usually I'm more active on there, but just with the new year and holidays and kids, I just haven't been on there much. But that's where you can find me. I have a ton of information there too.
Yes. Thank you so much, Laura, for being here.
Yeah, thanks for having me.